Good afternoon and hello. I'm Nidhi Heda, and today we are interviewing Dr. Amit Katti, who is an urologist and andrologist, and he owns Katti Center for Urology, Obstetrics, and Gynecology in Belgaum City. Hello, sir.
Thank you. Thank you for having me here.
Yes, sir. Thank you. Firstly, thank you so much for agreeing to do this interview with us.
It's my pleasure.
Yeah, so Dr. Katti, first let's begin with your journey in this field.
Okay. I'm a trained urologist and an andrologist. Actually, I started with MBBS in 2001. I did my MBBS and my post graduation in general surgery from JNMC Belgaum, and subsequently I did my masters in urology from MS Ramaya Bangalore. And since 2016 onwards, I'm practicing here in Belgaum in Katti Center for Urology, and it's an ongoing practice. It's a very humble journey that started 2016, and we are doing fine now. We are doing well, and we are having great strides in urology right now.
Yeah, so thank you. And let's begin with the podcast.
Yes.
So we have few questions for you. And the first question goes, what is prostate?
Prostate is basically a reproductive organ. It is exclusively found in males. So the organ is right below the bladder, and it surrounds the urethra on all sides. It's almost you can say, you can compare it to the size and shape of a walnut. So it is mainly a reproductive organ which mainly produces the ejaculatory fluid for young males who are less than 50 years of age.
Okay, so the next question goes, what is the common disease condition for prostate?
Prostate per se has multiple disease conditions. The most commonly being benign prostatic hyperplasia or BPH, which is rampantly found in almost all males. The other rarer conditions are prostatitis and cancer of the prostate.
Okay, so what is BPH?
BPH, as I said, was benign prostatic hyperplasia. It is the most commonest prostatic condition found in all males. I would actually venture up and say that it is more of a physiological condition rather than a disease condition. It is found in all males more than the age of 50, and it is almost there in every male over the age of 80 to 90.
Okay. What are the symptoms associated with BPH?
BPH per se is a constellation of symptoms which are mainly urinary symptoms, which can be both irritative as well as obstructive to the bladder. So when I initially said that the prostate is an organ right below the below the bladder, which is surrounding the urethra. So basically, it irritates the bladder or it obstructs the bladder. So the most common symptom that many patients complain is increased frequency. That is, a person who used to actually end up going to urine once in 2-3 hours ends up going to urine like every half an hour or hourly. So that is the most disturbing symptom, because he cannot go about his normal lifestyle or work without actually worrying about ending up in the toilet. And this symptom is present both during day and night. The others slightly lesser and more, which are not more so disturbing to the patients, are straining, incomplete emptying of the bladder, and passing little quantities of urine, and sometimes having burning urine. Those are the rarer symptoms.
So what is the most troublesome symptom like?
As I said, it is the frequency. It is the reason for which the patient ends up in the toilet every half an hour or hourly during day, and it also disturbs his sleep during the night. He may end up going for like 5-6 times in one night. So it's quite disturbing to the patient, and he does not get a good amount of sleep. He's disturbed with his work and disturbed during night as well.
Okay, so is BPH related to cancer?
Absolutely not. BPH is a totally benign condition. The word itself, it starts as benign prostatic hyperplasia. So it's absolutely not related to cancer. Cancer does occur in prostates, but it's quite rare, and it's not so rampant as in the Western countries in compared to the Western countries in our population. So it is not related to being a cancer. It's a benign prostatic hyperplasia. It can be treated quite simply.
Okay, so is BPH rare condition or how?
It's absolutely not a rare condition. As I said initially, it's more of a physiological condition rather than a disease. So any male over the age of 50 will have a chance of having prostatic symptoms as BPH, and over the age of 80 to 90, almost all males will have. So according to literature in our books, the incidence of BPH is almost 50% in age group of more than 50, but it almost touches 90 to 100% once the patient is more than 80 years of age.
Okay, so how is BPH diagnosed?
There are multiple modalities to diagnose this. The most common is basically you take a proper history from the patient. You ask what his symptoms are. So if all the criteria fit, like his age, he's more than 50 years of age, he has got daytime frequency, he has got frequency at night, he gets urgency, burning micturition. So that itself will indicate you towards benign prostatic hyperplasia. The other ways to diagnose are obviously by tests. So one is clinical examination. We do a per rectal examination or a digital rectal examination. So where we can find the prostate is enlarged. And imaging includes sonographies, both abdominal sonographies as well as transrectal ultrasounds. And later on, we can do cystoscopies, urine tests, urodynamic studies to confirm the diagnosis.
What are the some treatments available for BPH?
Depends again on what is the patient doing and what is his age group and what are his symptoms and how much is it bothering him. So let's say if I have got a patient of 50 to 60 years of age and he's got very mild symptoms, and generally such patients we consider to be sexually active. So in such patients we adopt a technique called as watchful waiting. So basically we keep calling him every 2 or 3 months to the clinic, keep asking his symptoms, keep doing a sonography or something, and assess his symptoms. If he is not having too much disturbance in his lifestyle, we just leave him alone. We don't treat him actively. If patient is more than 50 to 60 or more than 60, not so sexually active, has got significant bothersome symptoms, then we can even put him on a medical line of management. There are various molecules available for that, be it tamsulosin or silodosin. So depending on the patient's symptoms, we can add on to that. And the last option that we think of is invasive approaches, that is surgical approaches. So the good part of prostatic treatment is you don't need to cut open the patient for any kind of treatment for this. In a rare condition, there is an open prostatectomy, which I can tell you later. But most commonly, we do it transurethral, so it's an endoscopic procedures. So we introduce a endoscope through the urethra and we cut through the prostate and we clear enough a channel for the patient to pass urine comfortably.
Okay. So the last question is, what is the main concern of urologists that can affect the treatment of the patient?
Are two major concerns. Yes, one is, as I said, he being sexually active.
Okay.
So it depends on person to person. Some persons may not require the sexual component so easily, and some even older persons may require for a sexual component. So based on that, we titrate his dosage for medicines. For surgical treatment, the problem is if once I decide to go on a surgical method for any patient, he will have sexual issues. So those things have to be explained to the patient clearly. One, and the second thing is obviously he requires an anesthesia for any surgical treatment. So his other comorbid conditions, whether it's diabetic, hypertensive, history of any heart diseases, all those have to be considered. And one more point I would like to add is any history of cancer in his families. Prostate cancers is significant for us. So those cases we tread a bit cautiously, get a evaluation proper, and even get a serum PSA values, and see whether his prostate is whether a benign prostatic hyperplasia or a cancer of the prostate.
Okay, so would you like to share something related to urology and andrology? Anything specific that you think should be like known to people?
Um, Not per se for benign prostatic hyperplasia, but if I take the general topic of urology, then I would like to say a bit about stones, because in our country, with our kind of eating and drinking habits, we are prone for more stone formation because of our tropical climate, the heat, and the amount of dehydration we have. But the belief among our people, especially the rural communities, is that stones recur if operated by surgeons. And secondly, if that once I operate a stone of any kidney, the kidney gets damaged. That's a totally wrong concept, because nowadays our techniques are becoming so refined and so good that we hardly cause any damage to the kidneys. Absolutely. Those good old days of cutting open a patient, taking 10, 15 sutures and opening up the kidney and all are gone. We hardly do any open surgeries anymore. So it is just a little bit of awareness about stones that patient should have.
Okay, so thank you so much for joining us, sir. It
Thank you.
was
It's my
a
pleasure.
pleasure for us to know about all these things. So thank you so much. And we have Dr. Amit Katti. Yeah, and this is Nidhi Heda, sir. Thank you so
Thank
much.
you.
Thank
The
you
pleasure
so
is
much.
all mine. Thank
Yeah,
you.
yeah. Thank you so much.
Thank you.